Hello, I'm Dr. Gregory Ricca. I'm a neurosurgeon, and today I would like to share with you my routine preoperative instructions. In other words, what to do before surgery. This video is for educational purposes only and cannot cover all possibilities. Please make sure you have a thorough conversation with your surgeon. I believe that your surgeon and his or her team have the responsibility of providing you with the information you need. And I also believe that you have the responsibility of making sure you understand what is planned and what you are supposed to do. First of all, follow your doctor's instructions. These instructions are there to help you achieve a better outcome. Years of experience went into writing them. Avoid narcotics. This is especially true for those who have taken narcotics for a long time. Generally, the more narcotics you take before surgery, the more you will hurt after surgery. I encourage all my patients to decrease narcotic use as much as feasible before surgery. The brain adapts to the pain-killing effects of narcotics, leaving the person with the side effects of narcotics without much pain reduction. No smoking, including e-cigarettes. Smoking greatly increases complications such as poor healing, infection with the wound breaking open. This can cause quite a problem. It is better to heal well than to have to go back to surgery, take long-term antibiotics, and deal with frequent dressing changes. Being healthy, enjoying your life is preferable to having to spend your days taking care of a wound infection. Smoking just isn't worth it. Smoking also increases the risk of pneumonia, which will make you feel very poor and delay your recovery by weeks. Might even cause you to have to go back into the hospital to be treated. Smoking increases the risk of blood clots. Blood clots sometimes go to the heart and lungs, killing the person. I encourage my patients to lose weight if needed. Obesity, like smoking, greatly increases complications. Have rotten teeth pulled before surgery. The bacteria in rotting teeth are very aggressive. Some of the worst infections I've seen are from tooth decay. Please make sure you are not constipated. The medications given for surgery often make constipation worse. Back pain and back surgery generally slow the gut and cause constipation. Pain medications and muscle relaxants also slow the bowels. Being constipated after surgery is more than just a miserable feeling. Constipation can cause severe low back pain and pain that radiates down one or both legs. I've had patients stay in the hospital days longer than they should have and get studies of the low back to evaluate the cause of their back and leg pain, only to find out that their misery was caused by constipation. After aggressive measures to make them have one or more bowel movements, their back pain and leg pain decreased and they were able to go home. Avoiding constipation will help prevent unnecessary pain, nausea, vomiting, and a longer hospital stay. Please make sure your bowels are moving properly before surgery. Prior to surgery, we obtain preoperative evaluations. Sometimes we need to work with your primary care provider, often referred to as your PCP. Sometimes we need to talk to your heart doctor. And sometimes we need you to be evaluated by a lung specialist or other specialist. All of these are done to maximize your health so surgery can be performed as safely as possible. I like to say that elective surgery is safe because we make it safe. Some of our patients will have a pain agreement with another physician. We never want to violate that agreement. If you take pain medication on a regular basis, it is very important that you share that with us so we can contact your physician and coordinate your care. Pre-admission testing is another very important part of getting you ready for surgery. The nurses in pre-admission testing will review your medications, talk with the anesthesiologist if needed, run necessary tests, and provide you with some of your preoperative instructions. They often will give you a special antibacterial soap called chlorhexidine. Of all the testing we do, the most common cause of having to reschedule or cancel surgery is a urinary tract infection. If you think you have a urinary tract infection, or if you are prone to having them, please have your urine checked and treated by your PCP before your pre-admission testing. Another cause of having to cancel surgery is out-of-control blood sugar. I want your hemoglobin A1c to be below 7.25. Medications. The number of medications and possible combinations are far too great to allow me to provide a thorough review. In addition, the type of surgery you will have will also affect the way your medications need to be adjusted. With that said, I would like to review a few of my general recommendations. 2 weeks before surgery, I want all of my patients to stop anti-inflammatories. Anti-inflammatories are also called NSAIDs and arthritis medications. Some of the common anti-inflammatories are ibuprofen, naproxen, and meloxicam, and there are many more. Anti-inflammatories can increase bleeding during surgery. Increased bleeding makes surgery more difficult, increases blood loss, and increases complications. Provided it is safe, I like aspirin to be stopped 2 weeks before surgery. Like anti-inflammatories, aspirin increases bleeding. Please remember, many over-the-counter medications contain aspirin. For example, BC powder and Excedrin. Check your over-the-counter medications and make sure you do not take any that contain aspirin within 2 weeks of surgery. Acetaminophen, also known as Tylenol, is okay. Acetaminophen does not interfere with bleeding. Other than the 3 I will mention shortly, I want all supplements and all herbal medications stopped 2 weeks or more before surgery. Supplements and herbal medications can cause abnormal bleeding, and some can interfere with anesthesia. The 3 exceptions are multivitamins, vitamin D3, and calcium. I think these 3 are very important and can be taken up to the day before surgery, provided you are not taking unhealthy excessive amounts. There are many prescription medications that intentionally decrease one's ability to stop bleeding. These medications are often called blood thinners. We will talk to the physician who maintains you on these medications to see if it is safe to stop them so you can have surgery. Diabetes. Management of your diabetic medications will have to be tailored to you. I just want to mention 2 things regarding diabetes. The first is that I like to stop metformin 1 to 2 days before surgery and not start it back until 1 to 2 days after surgery. The second is about an insulin pump. Please talk to your surgeon about placement of your infusion port and your sensor, if you have one. We do not want either of these to get in the way of surgery or to be compressed during positioning for surgery. Showering. I like my patients to have 2 showers before surgery, one the night before surgery and one the morning of surgery. Some patients who have a total joint replacement are asked to take a shower every day for 5 days. The goal is to decrease the amount of bacteria on your skin and thereby decrease your risk of infection. I recommend you wash your hair and face normally, and then either step away from the shower water or turn the shower off and apply chlorhexidine to your body with a washcloth and allow this to soak for 2 to 3 minutes and then rinse off. Avoid your face, ears, genitalia, and open wounds. Sleep in clean bedclothes and clean sheets. Do not eat or drink anything after midnight the night before surgery. On the morning of surgery, take the medications you were instructed to take with small sips of water. On the morning of surgery, brush your teeth and do not swallow. Absolutely no gum, mints, hard candy, etc. What many may not know is that chewing gum or sucking on candy causes the stomach to release acid. During surgery, your muscles are relaxed and the acid from your stomach can go up your esophagus and then enter your lungs. This acid can damage your lungs and even cause death. On the day of surgery, do not apply makeup, deodorant, or anything else. We want your skin to be natural. Leave jewelry and other valuables at home. This includes rings. Sometimes during surgery, your hands will swell. They can swell to the point where a ring cuts off circulation and injures the finger. To prevent this, we might cut the ring off. Piercings can act as an electrical conductor and cause bad burns. The possible complications are not worth it. On the day of surgery, leave your contacts at home. Please bring your glasses and remember to bring cases for your glasses, hearing aids, and teeth. If you wear dentures, please do not use adhesive. You cannot wear your dentures into surgery. As always, please bring all your medications in their original containers. We do not need medications you are no longer taking. This is very important so we can make sure that whatever we give you before, during, and after surgery will react well with your regular medications. Wear loose-fitting clothing that is easy to get on and get off. Come to the hospital on time and bring something to occupy your time. Bring your CPAP. Some do not ask for this. I like you to have your CPAP in case you are admitted. Something that is very important to me is that you know what surgery you are going to have and why you are going to have it. I guarantee I will ask you. Now, I do not expect you to use medical terms, but I do expect you to have some understanding of what we are doing and why. Surgery. Is it safe? I think it is safe if we follow all the necessary steps. We work hard to make it safe, and your part is extremely important. Thank you for watching. I hope this is helpful. Please talk to your surgeon and his or her team if you have any questions.